According to the National Eye Institute, NEI, 4 out of 5 Americans over age 60 already have some form of vision problem, and most don't even know it. Even more concerning, nearly 50% of all cases of blindness in seniors could have been prevented if only they had been caught early. You see, many older adults assume that blurry vision, stinging eyes, or sensitivity to light is just a normal part of aging. But that's simply not true. These can actually be early warning signs of serious eye conditions, ones that may quietly steal your sight if ignored. I'll never forget the day Mrs. Eleanor walked into my clinic. She was 72, a joyful woman with a bright smile who loved knitting and reading every night before bed. She came in because she suddenly realized she could no longer clearly see her grandson's face while he sat in her lap. We did a full eye exam, and the results broke my heart. Late-stage macular degeneration. If only she had come in sooner, she might have been able to save so much of her precious vision. That's why today I want to share with you 9 early warning signs of eye problems that you should never ignore, even if they seem minor, even if they don't hurt, because the eyes are one of the quietest organs in the body. And by the time you notice something is truly wrong, it may already be too late. Sign number 9, dry burning eyes, or that gritty sandy feeling. Have you ever felt like your eyes were dry, slightly sore, or like there was a tiny speck of dust stuck in them, especially after waking up or spending time in air conditioning? That uncomfortable sensation. It's not just a mild annoyance. It's actually a common sign of dry eye syndrome, a condition especially common in older adults. As we age, the tear glands in our eyes become less effective. They produce fewer tears, and those tears are often lower quality, which means the surface of your eye doesn't stay properly lubricated. And that dryness? It's more than discomfort. It can directly damage the corneal surface. When your eyes remain dry for too long, the cornea becomes vulnerable. Over time, this can lead to blurry vision, higher risk of eye infections, chronic corneal inflammation or ulcers. According to the American Academy of Ophthalmology, nearly 5 million Americans over age 50 suffer from chronic dry eye, and women are at higher risk than men. Here's what you can do. Use a humidifier in your bedroom or office to add moisture to the air. Avoid sitting directly in front of fans or air conditioning for long periods. Blink often, especially when using phones, computers, or watching TV. Use preservative-free artificial tears as recommended by your eye doctor. If you're often feeling that dryness, that burning or gritty sensation, don't just brush it off. Let your eyes rest. Give them the care they need. Your vision matters, not just for reading or driving, but for truly seeing the people and moments that make life meaningful. Sign number 8, sensitivity to light, photophobia. Have you noticed that bright sunlight makes you squint more than it used to? Or maybe even indoor lights, or the glow from your phone or TV feel too harsh even when the brightness is turned down? If that sounds familiar, you might be experiencing something called photophobia or light sensitivity. Now, photophobia itself isn't a disease, but it is a warning sign, a red flag that something more serious might be going on inside your eyes. It could point to conditions like uveitis inflammation inside the eye, corneal inflammation, cataracts, or even glaucoma, which can quietly damage your optic nerve if left untreated. As we age, the muscles that control the pupil, that little black circle in your eye, don't respond as quickly. Normally, the pupil adjusts to light letting in more or less as needed. But when those reflexes slow down, too much light gets in too fast, and that can lead to eye strain, headaches, discomfort when using screens or going outside. It's more than just annoying. It can interfere with everyday things like driving, reading, or enjoying time with family. And here's something important. A study published in Ophthalmology found that photophobia was one of the first symptoms in over 60% of patients with chronic uveitis. So what can you do? Wear UV protective sunglasses when you're outdoors, even on cloudy days. Avoid harsh white LED lighting at home. Choose softer, warmer tones instead. If you spend time on screens, consider blue light filtering glasses to reduce eye strain. And if your sensitivity comes with headaches or lasts more than a few days, please see an eye specialist. Don't ignore that squint or that sting of light. It might be your eyes trying to whisper, "Something's not right. Please check on me." Sign number 7, seeing halos around lights. Halos. Have you ever looked at a street lamp at night and noticed a glowing rainbow-like ring around it? Or maybe, while driving, the headlights from oncoming cars appear blinding, surrounded by a strange halo of light. If you've experienced that, I want you to know, it's not just fatigue. It's not because your glasses are dirty. It's your eyes trying to tell you something important. This visual effect, known as halos around lights, is often an early warning sign of more serious eye conditions such as cataracts. As the lens of your eye becomes cloudy, it scatters incoming light, creating glowing rings around bright objects. Narrow-angle glaucoma. When pressure inside the eye suddenly spikes, it can also cause halos, often with eye pain, nausea, or a headache. Cataracts can develop slowly, and if not detected early, they can gradually rob you of your night vision and make everyday tasks harder. But narrow-angle glaucoma is a different story. It's a medical emergency. If left untreated, it can lead to permanent vision loss in just a few days. According to the CDC, over 20 million Americans over the age of 40 already have cataracts, and that number increases sharply after age 60. So what should you do? If you see halos, especially while driving at night, don't delay. Get your eyes checked. Consider wearing anti-glare glasses when driving in the evening. Make sure to get a comprehensive eye exam at least once a year to screen for cataracts and eye pressure changes. Remember, light should help you see, not make you uncomfortable. So if you ever notice halos around lights, that's not just a visual quirk. Sign number 6, blurry, hazy vision. Like looking through a thin fog, especially at night. Have you ever looked around and felt like everything had a soft, hazy layer over it? Almost like you're seeing through a thin sheet of fog. Maybe you've cleaned your glasses again and again, but things still look a little blurry, a little dim, especially in low light or at night. This is one of the most commonly overlooked signs of eye disease. Why? Because it doesn't hurt, and many folks just assume it's normal, part of getting older. But in reality, it could be one of the earliest signs of cataracts or dry-form macular degeneration. Let me explain. The lens inside your eye, which sits right behind the colored part, your iris, is supposed to be crystal clear. Its job is to help focus light onto the retina so you can see sharp images. But as we age, proteins inside the lens can clump together, scattering light and creating that foggy feeling even if your prescription is up to date. That's cataracts. Now there's also dry macular degeneration, the most common form of AMD in older adults. It slowly blurs your central vision, making it harder to read, recognize faces, or see clearly in dim lighting. If it's cataracts, you might notice your vision keeps getting dimmer. Lights seem too bright. Night driving becomes harder. If not treated in time with surgery, cataracts can eventually lead to blindness. If it's dry macular degeneration, the risk is different. Your central vision may gradually fade. And if left unmanaged, it can progress to the wet form, which is more aggressive and can cause permanent loss of central vision. According to the National Eye Institute, NEI, over 24.4 million Americans over 40 already have cataracts, and the number rises sharply after age 60, and more than 11 million Americans are living with macular degeneration. So what can you do? Get a yearly comprehensive eye exam, especially if you have noticed prolonged hazy vision. Eat foods rich in antioxidants like carrots, spinach, salmon, and berries. Consider supplements with vitamins A, C, E, and zinc, but only after consulting your doctor. Avoid smoking, as it dramatically increases your risk of macular degeneration. If you've started noticing the world around you looking dimmer, hazier, harder to focus on, please don't brush it off. That soft fog could be your eyes quietly calling for attention. And the sooner you listen, the better your chances of keeping your vision clear, sharp, and yours. Sign number 5, seeing floaters and flashes of light. Have you ever looked up at a bright ceiling or the clear blue sky and noticed tiny black specks, string-like shapes, or what looks like a little bug floating across your vision, or maybe every now and then you catch a quick flash of light, like a tiny bolt of lightning in the corner of your eye. Most people brush it off thinking it's just eye strain or something that comes with age, but in reality this could be a warning sign of something more serious, either a posterior vitreous detachment (PVD) or, more urgently, a retinal tear or retinal detachment. Let's break it down simply. Inside your eye, there's a clear, jelly-like substance called the vitreous. As we age, this jelly naturally begins to shrink and pull away from the retina, the light-sensitive layer at the back of your eye. That's when you may start seeing floaters or flashes. In most cases, a vitreous detachment is harmless, and the floaters settle over time. But in some people, about 7 to 10% according to the American Society of Retina Specialists, this pulling action can actually tear the retina. If the tear isn't caught early, it can lead to retinal detachment, a true eye emergency. Retinal detachment can cause permanent vision loss, often in a matter of days or even hours if not treated promptly. Here's what to watch for. A sudden increase in floaters, flashes of light in your side vision, a dark shadow or curtain creeping across your visual field. If you notice any of these signs, do not wait. See an eye specialist immediately. Every hour matters when it comes to saving your sight. And while you're under observation for a vitreous detachment, be gentle with your body. Avoid heavy lifting. Don't bend over suddenly. Try to stay calm and rested. You see, your retina is like the film in a camera. It captures every image you see. Even a tiny tear can distort or destroy the whole picture. So when your eyes start showing you black bubbles or little flashes of lightning, that's not your imagination. That's your eyes asking for help, and they need it now. Sign number 4, red or bloodshot eyes, more than just tiredness. Have you ever looked in the mirror and noticed your eyes looked red with tiny blood vessels showing even though you didn't stay up late or have any allergies? Or maybe the whites of your eyes just seem more tired, more irritated than usual. This isn't always from lack of sleep or little dust. Persistent redness can be a sign of underlying eye problems, especially as we get older. You see, after age 60, the tiny blood vessels in our eyes become more fragile. They can dilate more easily, become inflamed, or even rupture. Some of the possible causes include chronic conjunctivitis, long-term inflammation of the eye's outer layer, increased eye pressure, glaucoma, or even high blood pressure, which can cause small blood vessels to burst. And here's the part many people don't know. If that redness comes with eye pain, blurry vision, or nausea, it could be a sign of acute angle closure glaucoma, an emergency that requires immediate treatment. Chronic conjunctivitis, if ignored, can damage the eye's surface over time. Glaucoma, if not caught early, will silently destroy your optic nerve. And once that damage is done, the lost vision can't be brought back. According to the Bright Focus Foundation, only about 50% of Americans with glaucoma even know they have it. The other half often find out after they've already lost part of their vision. Here's what you can do. If your eyes stay red for more than 48 hours and there's no obvious reason, see an eye doctor. Avoid rubbing your eyes or using over-the-counter eye drops without medical guidance. Check your blood pressure and blood sugar regularly. Your eye health reflects your heart health too. If glaucoma runs in your family, get your eye pressure tested every 6 months. So the next time you notice red eyes that just won't go away, please don't brush it off. Sometimes what your eyes need most isn't just a bottle of drops. It's your attention, your care, your willingness to listen to the warning signs. Because often red eyes are more than just tired eyes. They're your body's way of asking, please, check on me before it's too late. Sign number 3, you're changing glasses too often and still not seeing clearly. Have you noticed that your glasses don't seem to last as long as they used to? Maybe you just got a new pair a few months ago, but suddenly you're struggling to read again, or distant objects look blurry even though your prescription is supposed to be up to date. Many people chalk this up to just getting older. But here's the truth. Frequent changes in your glasses prescription, especially in a short amount of time, may be a red flag, not of aging, but of something more serious going on inside your eyes. In particular, it could be a sign of retinal complications or damage caused by chronic conditions like diabetes or high blood pressure. So what exactly could be happening? When the delicate blood vessels or tissues in the back of the eye, the retina and macula, become damaged, the shape and thickness of those structures can change. That affects how light focuses in your eye, and suddenly your new glasses no longer work the way they should. Common causes include diabetic macular edema, swelling in the retina, retinal bleeding or hemorrhage, optic nerve damage. These changes can lead to sudden or progressive vision loss, difficulty reading, driving, or doing daily tasks, permanent damage if the optic nerve is affected for too long. According to the CDC, around 9 million Americans over age 65 are living with diabetes, and nearly one-third of them have eye complications they don't even know about. So what should you do if your prescription keeps changing? Don't just accept new glasses. Ask your eye doctor. Why is my vision changing so quickly? If possible, request a retinal scan, OCT, to check for swelling or damage in the back of your eye. Keep your blood sugar, blood pressure, and cholesterol under control. Follow a healthy diet, low in sugar and salt-rich in vegetables and omega-3s. And remember, new glasses aren't the solution if your eye health is silently declining. The key is not just to correct your vision, but to understand why it's changing and to care for your whole body to protect your eyes. Because every prescription tells a story, and if your glasses keep changing, it's time to listen to what your eyes are really trying to say. Sign number 2, trouble seeing at night, especially when driving. Have you ever struggled to drive at night? Do the headlights from oncoming cars feel blinding? Do you find it hard to stay focused or feel a little disoriented when walking outside after dark? If that sounds familiar, you're not alone. And it's not just aging eyes. Many people assume this is a normal part of getting older, but in reality, it could be an early warning sign of cataracts, retinal degeneration, or age-related problems with how your eyes adjust to light and dark. What's really happening? As we age, the eyes lose their ability to quickly adjust between bright and dim lighting. At night, your pupils don't widen as effectively, and the light entering your eyes doesn't focus properly on the retina. That's why streetlights may seem too dim, headlights cause glare, and your night vision just doesn't feel sharp anymore. These problems may be worsened by cataracts, scattering light and creating glare, retinal degeneration, making images appear dim or blurry, glaucoma, gradually shrinking your peripheral vision, especially noticeable in the dark. This doesn't just affect your eyesight, it affects your life. Increased risk of nighttime car accidents, loss of confidence during evening activities, social isolation, avoiding dinners, events, or walks after sunset out of fear. According to the National Eye Institute, NEI, over 50% of Americans over 65 have difficulty driving at night, and many don't realize their eyes are the reason. What can you do? Avoid driving at night if you experience glare or poor visibility. Install night lights at home to prevent falls or accidents. Try anti-glare glasses specifically designed for nighttime driving. And most importantly, get regular eye exams, including vision testing, cataract screening, and retinal imaging. Here's the truth. Nighttime should never feel scary. Not in your home, not on the road. So if you're noticing more glare, hazy vision, or difficulty adjusting to the dark, don't wait. Your eyes may be trying to tell you something, and a simple checkup today could help keep your nights clearer, safer, and more confident for many years to come. Sign number 1, gradual loss of central vision, like a black spot right in the middle. Have you ever looked at someone's face, but couldn't quite see their nose, mouth, or eyes clearly? Or maybe while reading the words in the center of the page look blurry or distorted, while the text around it remains sharp. This is a classic sign of central vision loss, and one of the leading causes is a serious condition called wet age-related macular degeneration, AMD. The macula is the small but vital part of your retina responsible for sharp, detailed vision. It's what lets you read, recognize faces, and drive. But when it becomes damaged, especially from wet AMD, the center of your vision starts to fade and daily life becomes a struggle. Unlike the dry form of AMD, wet AMD progresses quickly. It causes abnormal blood vessels to grow and leak under the retina, damaging the macula rapidly if left untreated. And the hardest part, central vision loss from AMD is irreversible. Without it, you may no longer be able to read, write, recognize faces, or drive independently. It deeply affects your quality of life and your ability to care for yourself. According to the American Macular Degeneration Foundation, more than 11 million Americans are already living with AMD, and that number could double by 2050 if we don't take early action. What can you do? Use an Amsler grid at home once a week. It's a simple tool that can help you detect early changes in your central vision. Eat plenty of dark leafy greens and colorful fruits and veggies like carrots, oranges, and red peppers, rich in lutein and zeaxanthin. Talk to your doctor about supplements with zinc, vitamin C, and vitamin E. And most importantly, get regular eye exams, especially if you notice blurriness or distortion in the center of your vision. A gentle closing message from me to you. My friend, if there's a black spot or a blurry patch right in the middle of your vision, please don't ignore it. Let your eye doctor take a closer look, because protecting your central vision is about so much more than just seeing clearly. It's about keeping your independence, your confidence, and your ability to enjoy life every single day. You see, our eyes aren't just the windows to the soul. They are the open doors that lead us to our loved ones, to the beauty of the world around us, and to the moments that make life meaningful. Once we reach our 60s, even the smallest change in our vision could be a precious signal, a chance to act, to protect, and to preserve the light in our lives. And here's the good news. It doesn't matter how many signs you may have missed before today. What matters is that today, you choose to care for your eyes, because caring for your vision is caring for your freedom, your joy, and your quality of life in your golden years. If this video has been helpful, please subscribe to the channel so you won't miss any upcoming tips on aging well, staying healthy, and protecting the life you love. And I'd love to hear from you in the comments below. How old are you today? What state or city do you live in? Which of the 9 warning signs have you experienced? Thank you for spending this time with me. Let's spread this helpful information to friends, neighbors, and loved ones so that everyone has the chance to protect their precious vision. Take care, and I'll see you in the next video.